Oh, summer is here, and so are the chances for not only a big splash, but sunburn, stings, sprains, all of the stuff that can ruin the fun. So today, Christie Leath-Warren with Cone Health Urgent Care at Reidsville is here to share important and practical recommendations to have us go through summer and be healthy about it. All right, let's start with this. The working in the yard, the poison ivy. Let's talk about a few simple ways to avoid it, and then what do we do to treat it if we have a mild case at home?
So the first thing is knowing what it looks like, understanding, okay, that weed is poison ivy, I need to stay away from it. And a lot of us don't know that. If you do come into close contact with it, the first thing you want to do is wash your skin immediately. It's not just the plant, but it's the oil from the plant that gets on the skin. Next thing, if you're out in the woods walking, make sure you're walking on a clear path. Don't walk where there are a lot of weeds and things that you don't know there are there. And of course, wear long sleeves, long pants, socks, protective clothing to help protect your skin from becoming into close contact with that oil from that plant.
Yeah, you're working in the garden, you need to have those long sleeves and long pants. All right, so at what point should we contact or think about going to our healthcare provider if we came into contact with poison ivy and it's just not going away?
So, a lot of things you can do at home, like I said, washing the skin. You can use anti-itch creams like Benadryl or hydrocortisone cream. You can do oatmeal baths, those kinds of things. But if the rash is over the entire body, it's in your face, it's in your eyes, it's all of your legs, your arms, it's kind of hard to treat that at home. So you definitely will need to seek care for that. Also, if you've had the rash for a while, and it starts looking, infected, the area on your skin is more red, it's itchy, it's swollen, then I think you need to seek care at that time.
Okay, gotcha. All right, let's move on to bee stings because they happen all the time. If you or your child is stung, what should you do right away?
Right away, first thing you want to do is try to remove the stinger if you can. Next thing, like I said with poison ivy, you want to wash the skin. Depending on, the type of reaction that, you have, some people can get away with taking an antihistamine like Zyrtec or Benadryl or Allegra, something like that over the counter. But more severe reactions, say if someone has trouble breathing, they're wheezing, their throat or tongue starts swelling, anything like that, that's an ER visit immediately.
Okay, and when you say take the stinger out, you mean not with our fingers, right? But you want us to use tweezers and
No,
stuff because we could get some stuff on
yeah,
our hands too if we do that.
absolutely, absolutely. And just be very mindful of what you're doing and be safe when you do it.
Okay, and so again, you said any kind of like loss of breath or that kind of thing, you go right to the ER.
Exactly,
Okay.
exactly.
All right, so mosquito bites, we know. I just did a story about what kind of, bug spray that you should use to prevent it. What happens when we've got them and they're like so itchy? What can we do to make that itch stop?
So again, like I said, the over-the-counter antihistamines, which I think will be our friend for the entire summer, something to help with the itching. Cool compresses to help with inflammation because it's really just a small reaction to that area of skin. So you want to help calm that reaction down. Again, try not to scratch it or rub it because the more you scratch it, the more chance of it becoming getting worse. You may get an infection. So just try to, use your anti-itch creams like hydrocortisone cream, Benadryl cream. Now, if that doesn't work, again, it gets worse. It's not getting any better with what you're doing at home, then definitely seek care. Come and see us at Urgent Care.
Okay, let's move on to sunburns. People might already have their first sunburn of the season. Let's talk about the prevention recommendations and what do we do when you get burned? Like a lot of people like to peel off the sunburn and stuff. Should we be doing that?
No, you really shouldn't. I mean, when you're out in the sun, you want to be mindful of the time that you're out in the sun. So you want to limit your exposure because those UV rays are very damaging to the skin. If you're going to be out for long periods of time, wear long sleeves, protective clothing, and also don't forget your sunblock, your sunscreens. With your sunblock, you want to look at the SPF or the sun protection factor. You don't want to do anything less than a 30, especially if you're going to be out in the sun for long periods of time. If you do get sunburn, cool compresses to the area. Don't peel it, don't irritate the skin. If you have to go back out into the sun, you want to also protect the skin to keep it from getting burned further. Biggest thing, if it's not getting any better, if you've done all these things, you've used aloe vera, which is our #1 go-to for sunburn, you know, seek care, go to urgent care, because like I said, sometimes these things can get worse.
Okay. Falls, accidents happen while doing yard work. I thought about this while I was thinking about I need to like paint my shutters that are on the second floor. So if that kind of stuff happens or something happens, the kids are on the playground, how do you know if a fall or injury means a trip to the urgent care versus the emergency room versus maybe just calling the doctor?
So, and that's a very, very thin line, to be honest with you. So, urgent care, if you have pain or swelling, you're concerned, well, I don't know if it's broken, it hurts a little bit, but I'm not sure. Or if you have pain when you're moving that area, wherever it is, or if you have pain when you're walking on it or bearing weight. Now, ER, if you see a protrusion of a bone through the skin, if you I know it doesn't sound fun at all. If you have a deep wound or uncontrolled bleeding, then that's definitely a trip to the emergency department. As far as like a virtual urgent care visit, if it's a minor abrasion, a minor scratch, or minor scrape, you can start there. And then, of course, if it's not getting any better from that point, then you can seek care later at a local urgent care like Cone.
Okay, all right. So we've done a whole smattering of them. We're going to come back and do a whole smattering more. Like, what about if you get bitten by something, like a snake or something like that? What should you do? We're going to talk about that next.